KC Live, I'm Laverne McGee. Today we're honoring the life and legacy of General Colin Powell. The former Secretary of State and Chairman of the Joint Chiefs of Staff died this morning at the age of 84. Secretary Powell served this country over the course of 4 decades, breaking barriers at every turn. Now today we're learning that the Secretary of State, General Colin Powell, battled a type of blood cancer for many years. Joining me now to talk about this is Dr. Shika Jain, professor of medicine at the University of Illinois Cancer Center in Chicago. Doctor, thank you so much for joining us. I think so many of us are surprised because he seemed like the picture of health. We've been hearing about him for decades, and then we hear about this blood cancer. Tell us about what it is that he was suffering from.
Absolutely. And thanks for having me on today, Laverne. So it's very sad to hear of General Powell's passing. And it is very common that people who have multiple myeloma may not outwardly look sick because they may be getting treatment or they may have received treatment in the past. The way multiple myeloma works is in your cells that are supposed to be creating the immune response. When you get sick, when you get a cold, or when you get some type of illness, those cells are actually replaced by cancer cells. And so the cancer cells often push out the more needed immune cells that would help you mount a response against an infection. And so it is very likely that because Colin Powell had this multiple myeloma diagnosis, his entire immune system was compromised, thus not allowing him to mount an immune response to whatever infection he may have encountered. And that's one of the reasons why, even though he was vaccinated, there was a risk that he may not be able to protect himself from COVID-19 because patients who are immunocompromised or who don't have an immune system that's functioning at a full capacity are at higher risk for getting very sick from COVID, even if they are vaccinated, because their body just can't mount the immune response that's needed to take care of the virus.
Yeah, and Dr. Jain, that was the other thing that we were hearing, that he was actually just about to get that booster shot. Could that have maybe saved his life?
So it's impossible to say. It might have helped. It might have helped the symptoms not be as severe. But the challenge is when you have somebody who is older, they're already at a higher risk for having complications from developing COVID-19. Then on top of that, from having a cancer diagnosis. And then he may have had other medical problems as well. So when you contract COVID-19 and you're vaccinated, for the most part, you shouldn't have many symptoms. You should do okay because your body knows now it has the armory to fight this infection. Unfortunately, because he hadn't gotten his booster yet, it is possible that he might have lost some of that protection that he had initially, but it is also possible that he may never have mounted a full response because of his multiple myeloma diagnosis and also because of his age. That's why it's so important for everyone to get vaccinated, because not only do we want to protect ourselves, but we need to protect those people who are vulnerable, our older population, patients who have immunocompromised medical problems, because if we contract COVID and give it to them, we may not get very sick, but they may get very sick because their body does not mount a full immune response as other people's do.
But Dr. Jain, that's part of the question here, the confusion, because I've been on social media and there are some people, again, who are, hesitant about getting the vaccine, and they're using this as a reason to say, well, see, he had the vaccine, he had the Pfizer shot, he had 2 doses, and it still didn't protect him. How do you explain that to people who are actually trying to turn this around and say, well, see, it didn't work?
We are seeing that all over social media. And what I want to tell people is the majority of people that we are seeing dying from COVID-19 are people who are not vaccinated. It's a very small percentage of people. I think it's around 2% or less who we're seeing who are dying if they are fully vaccinated. And usually those people also have other medical problems that mean the vaccine was not going to give them a full response. So this does not mean vaccines do not work. What it means is even though you can be vaccinated, you may have a breakthrough infection. If you are older and if you have other medical problems, it is possible that you could still get sick from COVID. That's why we need to stop the spread, and that's why we need to get everyone vaccinated. But vaccines work extremely well at protecting the majority of people from getting very ill from COVID. The vaccine protects you from getting hospitalized and from dying from COVID. Unfortunately, in General Powell's situation, he did not have a robust immune response because of his other medical problems. So So it is up to us to prevent the spread of COVID so that those people who are at higher risks aren't going to end up getting very sick from COVID, even though they're doing what they're supposed to, which is getting vaccinated to protect themselves, because the vaccines absolutely do work and they protect the majority of the population.
All right, Dr. Jane, thank you so much for clarifying that for us and helping us through his diagnosis. We appreciate you being with us here on BNC. And our Anthony Amy takes a look back at the life of former General Colin Powell, from his working class New York upbringing to one of the most powerful men in America.